The first of those speakers is my colleague, Dr. Rachel Denholm. She's an epidemiologist and health services researcher in population health sciences at the University of Bristol. She obtained her PhD from University College London and then went on to work at the International Agency for Research on Cancer in Lyon in France, and then at the London School of Hygiene and Tropical Medicine before coming to Bristol. And she's particularly interested in the use of electronic health record data at the level of our region in Bristol, all the way up to the level of the whole of the English population, to investigate the etiology, management and delivery of care to patients with multiple chronic conditions. Rachel, we look forward to hearing from you.
Thank you, Jonathan. So my talk is really giving you the background to these environments and really the change in ways of working that has transformed our research in the last couple of years. So today I'm going to kind of talk to the rise of secure data environments in the UK. I'm going to talk to two examples that we've been using across our collaboration in the UK, and then finally just touch on a subnational regional programme that is underway at the moment. This is a multi-institute collaboration across the UK, so just to acknowledge a lot of people have been involved in this work. So first, what is a secure data environment? So currently, ways of working involve very much a data sharing process where the researcher proposes a project, has to undergo a series of project-specific information governance, ethics, legal processes that are often non-standardized in order to get the right approvals to do the work, then get hold of the data, link it all together, and it's sent to the researcher in their organization where it's held, and they are then do the analysis, and once the project's over, it's deleted. This process is often time-consuming, hugely resource-intensive, and often is the cause of failure of a lot of research projects. What the secure data environment does is it brings all the data together in one place, does all of the information governance, legal and ethical processes to allow that data to be used for research, and it means that the researcher only has to undertake one process, one approvals process to get hold of the data. The data is then stored in one location and the researcher comes to the data stays where it is, they can't download or copy that data, and once their project has been completed, their access is removed. And this really speeds up the process to data access, but it ensures the confidentiality and security of unconsented patient data. And this is all done through the 5 SAFEs principles in the UK, where we talk about safe data, where the information is pseudonymized or minimized. The projects have undergone ethical and often patient and public engagement. The people who are accessing the data are accredited and come from accredited organizations, and the secure data environments meet a set of standards to ensure that they are safe and secure, and that everything that comes out of the environment has to undergo a review process. As Jonathan mentioned, the value of electronic health record data really hit the forefront during the pandemic, where information was captured in multiple places and then due to changes in governance could be linked and accessed at a rapid scale. And this led to a huge increase in real-world data projects and publications during the first couple of years of the pandemic. And in England, 2 of the national data resources I'm going to talk to led to huge changes in the response to the pandemic and national and international attention. And so in England, this led to 2 policy papers, the Goldacre Review Better, Broader, Safer, and the Data Saves Lives policy paper, which really highlighted the value of our electronic health record system and also suggested ways in which this data could be accessed securely and quickly. And then this led to the Department of Health and Social Care highlighting that secure data environments will become the default way NHS health and social care data will be accessed for research. And this isn't the UK has a long history of secure data environments, or otherwise known as trusted research environments, with one of the companies, SERP, has long been supporting national data resources, the Sale Data Bank in Wales and ECRIS in Scotland as well. So England were very much late to the game, really, in terms of secure data environments. But after the two white papers and the new changes in guidelines, the NHS England Data for R&D programme suggested a new interoperable network of secure data environments. So now there's 3 strands in which that each have a different remit: the national population-wide secure data environments, which have high-level population-wide data coverage across primary and secondary care, a new programme of subnational secure data environments, which focuses on granular secondary care data and multimodal data, and then finally the clinical and research clinically rich, well-phenotyped data environments for research. So Genomics England and Biobank and Our Future Health are examples of that. And today I'm going to talk to 2 of these population-wide secure data environments: the NHS England Secure Data Environment and Open Safely. So the NHS Secure Data Environment is a platform where pseudonymised patient records are made available for a community of researchers across England, with one approval process, one access platform, and linkage across primary and secondary care and specialist services. Open Safely is a secure, transparent, open source software platform, and then for this all activity is shared and logged publicly. The software is set up for open access and reusable pipelines, and this is all done using publicly available websites and data programs. So thinking about the data here and the really rich data that we have available in these platforms, just comparing the 2, we have primary care data. Open Safely is embedded within the primary care software systems, whereas the NHS England Secure Data Environment holds an extract of all GP practices across England, covering 98% of the population. The secondary care data is for a remuneration data set, which is used for service delivery and planning, and it's high-level information. Registered deaths are included in both environments. Open Safely includes high-cost drugs, and the NHS Secure Data Environment includes medicines dispensed in primary care. Here I'm comparing to another primary care resource some of you may be familiar with that's available in England, which is the Clinical Practice Research Data Link. And just as a bit of a background, in England there are 2 major primary care software systems that are available and dispersed regionally around the country, and that is TPP and EMIS. Open Safely work with both of these software providers, with 24 million active records in TPP, and this goes up to 55 million when EMIS is included, and this compares in CPRD to around 13.8 million active records in the EMIS Aurum data resource. For the English Secure Data Environment, that's a whole population level, so we have 55 million primary care records, 55 million people's primary care records in that environment. In terms of the frequency and updates, in Open Safely it's with real time as it's embedded within the software system. The NHS England has a fortnightly update, and this compares to monthly in CPRD. As I've mentioned, there's regional variation across Open Safely and CPRD. In the NHS Secure Data Environment, it includes everyone alive on the 1st of January 2020. And again, just to reiterate, NHS England has an extract of all patients' medical records, an extract of patients' medical records compared to the whole medical history being available in Open Safely and CPRD. There is specialist data available in both environments. These include disease registries, including the UK Renal Registry and Open Safely, as well as disease audit programmes such as the Sentinel Stroke National Audit in the NHS Secure Data Environment. The NHS secure data environment holds a lot of commissioning data sets as well, which are used for service delivery and planning, including the maternity services data set and as well, and a rich range of mental health data. So the secure data environments really change the way people work with these data, and it changes the workflow. So for a standard electronic health record project, people will be familiar with the idea of developing code lists to define your covariables, defining your study population. You then perform the analysis and then you get your output out. With secure data environments, there's an additional step where you have to release those outputs out of the secure environment. Within the NHS secure data environments, pseudonymized individual patient records are available, and there's a series of software such as GitLab to facilitate team science working, as well as a range of analytical software as well. In Open Safely, there's a very different way of working where code is written and tested against dummy data. This is then synced to GitLab and pushed to the secure data environment where the individual level record data is held. Aggregated outputs are viewable via a VPN, and this is then released via online platforms. So to support this way of working, there's a host of software development to support this. So open code lists facilitate the execution as well as development of disease and exposure and outcome related variables, and this is embedded within the study definition pipeline. There's a specific data curation pipeline available that is used in Open Safely, and this is all delivered via Urkel, which is a bespoke language, and this is all synced up to GitLab, where it's then pushed to the real data in the software systems via a web portal called Open Safely Jobs, and then outputs are released on a level 4 server, which requires VPN. And the big change is from my opinion, it's around the output checking. So in both environments, you have to release files for review. This includes a copy of what you want released, contextual information, and then a review process. Within Open Safely, this is a human review, so an individual reviews this, whereas in NHS England, they have incorporated electronic checks. Open Safely, the files are released via a publicly available job site server, and all of those outputs are publicly available. In the NHS secure data environment, files are released via a secure portal where the user is then emailed. So this change in working really protects the privacy of the individual's, again, unconsented data that we are accessing. So one of the limitations in terms of the data available within the population-wide secure data environments is the hospital data, which is a very high level, includes limited information on diagnoses and therapeutics and procedures that patients undergo whilst in hospital. So in order to tackle this challenge, the NHS England has developed a subnational secure data environment where real-time multimodal data will be available. There's 11 of these programs underway across England, with the ambition of them being interoperable across different subnational secure data environments. And that really was a whistle-stop tour of the advancements within the last couple of years in England. Thank you very much for listening.